Well, turning now to your health, the burden of fertility issues does not just rest on women, though it can certainly feel like that sometimes. Experts say the lifestyle choices that men make can have an impact as well.
And that's why on this National Men's Health Month, we are highlighting the do's and don'ts when it comes to paternal health. Joining us live now to share those tips is registered dietitian nutritionist Ayla Barmmer. Good morning.
Good morning.
Appreciate you taking the time. It's kind of going off what Emily was just saying. You know, when you talk about infertility, I feel like you have this conversation. Is it you? Is it me? Is it male or female? What is the answer to that?
Yeah, this may be surprising for listeners to hear because infertility, as you said, is generally viewed as a women's health issue, but in reality, it's equally both. To put this into perspective, about 30% of infertility issues are due primarily to male factors and 30% due primarily to female factors. And the remaining 40% is categorized as unexplained infertility, which tends to mean a combination of both male and female factors. So truly, it's a shared issue, despite the fact that men are often left out of the equation, or at best simply viewed as having one role, which is contributing sperm for fertilization, when in reality, men's health affects the health of the pregnancy and baby's health long term, so it matters a lot.
So this is a hugely important topic. You know, my heart goes out to any couple struggling with infertility. It's so tough, and I think it can feel so scary and so hopeless, right? To look at, to think, oh my gosh, we're gonna have to go through all these expensive procedures or IVF or all these things. What can people start with? What can men do that could really have an impact on fertility and on baby's health?
This is exactly why I got into this work, because fertility treatments can have a financial, mental, and physical toll on couples and be a huge stressor in relationships. But nutrition and lifestyle factors can be easy. And actually, I want to share just 4 easy things that men can do that can dramatically improve their fertility health. So number 1, first and foremost, we want to really flood the body with the right stuff to help combat the things that we can't control, such as age, genetics, or certain environmental exposures. So top of that list would be eating a diet high in antioxidants and omega-3 fatty acids. Think fruits, vegetables, seafood, including shellfish, which are uniquely high in sperm-supporting nutrients like zinc and selenium. We want to exercise routinely to deliver fresh, oxygenated, nutrient-rich blood to pump through the body. That helps with good hormone balance. And get 7 to 8 hours of sleep at night. Ideally, that's as closely in sync as possible with the light and dark cycles, because our circadian rhythms are actually very much tied to our reproductive health. And it's one of the reasons why we actually see more fertility issues in night shift workers. And because we're living in modern environments with so much blue light exposure and on our phones and everything at night, this can be a real challenge. Then lastly, daily supplementation, because we're not going to be able to do all of those things perfectly every single day. We're all human, right? So a high quality supplement like Fullwell's Vitality and Virility formula can really help fill those gaps and support sperm quality.
What else can men do to avoid, or what should men be doing to avoid, to decrease fertility along with those lines? You have the do's, what are the don'ts?
Yeah, so top of that list for me is actually chemical and heavy metal exposure. So the reality is that we're exposed to more environmental chemicals and pollutants today than any other time in history. Some big bang for your buck type of things to focus on to reduce your toxin exposure, especially for men, is to swap out fragrance products, which have known hormone disrupting chemicals in them, with natural options. So think cologne, fragrance, deodorants, air fresheners, those wall plugins, car air fresheners. Ditch those altogether. Or if you have some things that there are things available that are just like essential oil based that can be better natural options. Now, alcohol is number 2, and I know that isn't a popular one for me to say, but it doesn't necessarily have to go entirely, but I would encourage men to think about your partner who won't be drinking throughout a pregnancy. So if men can avoid or greatly reduce their alcohol intake at least 3 months before trying to conceive, that window of time is going to mean healthier sperm, healthier pregnancies, and healthier babies. And then lastly, smoking, particularly cigarettes. The thing about sperm is that they are very sensitive to what's called oxidative stress, and cigarette smoking generates a lot of that. So we can combat some oxidative stress with the right nutrients and flooding the body with those. But the best thing to do is to get rid of the big straws on the camel's back, so to speak.
Okay. And these are changes that, if done a few months in advance of really trying to start a family, those could have a real impact?
A huge impact. Both men and women, actually, the interventions are very similar. So these are things that couples can do together. You don't have to be on separate protocols. And that window of 3-4 months prior to pregnancy, although as long as possible is great, is really the key window, because that's when sperm and egg are developing and ultimately what will be conceived with. And just to give a sense for your audience of the impact here, so men's health and what they're doing in that window of time can actually affect really common pregnancy complications like preeclampsia, gestational diabetes, preterm birth, pregnancy loss. So the stakes are high, and and again, they're relatively easy things to implement to have a huge impact on the health of the pregnancy, health of baby over the long term. So far beyond just that positive pregnancy test.
Wow, that's
A
fascinating.
lot of really good information this morning. Really appreciate your time. Registered dietitian nutritionist Ayla Barmmer. Thank you for the tips and again, kind of clearing the air. It's not just one person. You know, everybody's got
Team
to
effort.
team effort for sure. Team effort for sure. Appreciate your time.
Thank you.
Thank you. And for more fertility advice and products that could help, check out Ayla's Vitamin Company. Just go to fullwellfertility.com for that.
Okay.